thank you for being here. Happy Wednesday morning?
It's Wednesday.
And almost end of August, getting ready to move into September. So again, thank you for being here this morning, and we're going to begin. We are recording, and let's go ahead and do roll call.
I'd be happy to. Eddie Mesh.
Here.
Ashley Jackson. Here. Dr. Brian Fuller.
Here.
Dr. Gina Rourke. Here. Tommy Smith.
Here.
Nikki Norton was on here. Dr. Dan Tyrone.
Here.
Dr. Jane Cassidy. Here. Desiree Honoré Thomas. Dawn Harris. Here. Dr. Jermaine. Who's not here? Dr. Cynthia Bryant. Gina Doucette. Here. Dr. Mark McLean.
Present.
Beth Alford. Here. Kenny Harbaugh.
Here.
Dr. Samuel Gladden.
Here.
Trey Roche.
Here.
Dr. Wendy Palermo. Here. And Heath Williams.
Here.
Great. We have a quorum.
Wonderful. The first item on the agenda is approval of minutes. Elizabeth, thank you for sending those out. I trust you've had an opportunity to review, and we'll entertain a motion to accept the minutes.
Make a motion to accept the minutes.
Second.
Anyone opposed? All right, minutes are approved. All right, next item on the agenda, presentation of phased retirement plan options for university. And so we're going to ask Elizabeth if you'll please walk us through the slide.
Sure, happy to. So we reached out to some of our colleagues across the country, and we are grateful to Ms. Brenda Mundell to join us today from the Commonwealth of Pennsylvania. She's going to go through what Pennsylvania state system of higher education does as it relates to phased retirement. And then we also reached out to one of our colleagues down in New Orleans at Loyola University of New Orleans, and Kristen and Rachel will present on what they do just a couple of minutes down the road from us. So we'll start with Brenda. I did a couple of slides based on the information you provided, Brenda. And then also in your folders, I included the phased retirement application as well as the template letter requesting for phased retirement. So that is in reference there. And then the slides are just based on the information that is provided on their website. So I'll just go ahead and Brenda, you can take it away from here.
Okay, thank you, everyone. It's really great to be here. Looks like you have quite a group. I know we won't have time for introductions. I'll just introduce myself. I've been with the Pennsylvania State System of Higher Education for about 17 years. My role is Director of HR Shared Services. I work at the system office. We are headquartered in Harrisburg, Pennsylvania, and I support the 10 state system universities. We used to be 14. A couple of years ago, we underwent an integration effort, and we integrated some of our universities together into larger universities. So now we have 10. A number of years ago, we identified a need, as I'm sure many of you struggle with too, in terms of workforce management and cost. And we are collectively bargained heavily. In Pennsylvania, our faculty are represented by a bargaining unit called ABSCA, as well as most of our other employees. We are about 90% collectively bargained workforce. And so our workforce overall was and still is fairly mature. And we recognized a need jointly with our faculty union to develop a program that would allow our faculty to phase into retirement. And so we established a committee through negotiations, and it was a joint labor management committee. I was the co-chair for management. A colleague of mine was the co-chair for the faculty union, and we met together probably 4 or 5 working sessions in order to reach agreement on a side letter to govern the phased retirement program. This is just for faculty. Although, over the years, I've been approached by many other employees saying, why can't we have one too? It is the faculty role allows itself to be more easily backfilled with temporary or adjunct faculty members, as well as assigning workload to other faculty members through the use of overload. It is much more it's much more easy to do this for a faculty position than it would be, say, for a senior manager. What do you do with the rest of their job that they're not doing while they are phasing out towards retirement? Very difficult in that type of a role to hire a qualified, experienced individual to do parts of that job on a part-time basis. Also equally difficult in our very lean environments that I know we all operate within now, to just take parts of that job and assign it to another existing employee. And so at the state system, this is just for faculty. And so as you can see here, after several meetings and negotiations, and we did, our process involved quite a bit of research, as you are doing now, and we also met with and talked with colleagues at other institutions that we knew had phased retirement programs, much like you're doing now, to try to pick the best elements from their programs to incorporate within our own. And so we ended up with a program, as you're looking here, that allows a faculty member to phase out over a 3-year period at a reduced schedule. And I will have to tell you, they could certainly choose something less, like 1 year or 2 year, but the vast majority do use those full 3 years to phase out into phased retirement. We prorate the salary based upon, the prorated workload. We do require that faculty members have already attained the years of service necessary for retirement with retiree health benefits before they begin a phased retirement arrangement, because if not, things happen, and we would not want a faculty member to be stuck with retiring on a certain date without achieving the service that they need for the very valuable retiree health benefits that we provide. So we do require that to be already achieved up front. And certainly if they need to also reach an age, that as long as that occurs during their phased retirement window, that's allowable. So we do limit this, as you can see, to our regular full-time faculty members. It was an important criteria to our faculty partners while we were negotiating this, that those faculty members who are participating and are enrolled in our ARP plan, which is our alternative retirement plan. It is a defined contribution plan, as opposed to our other plans, which are provided, which are defined benefit plans, is that if they are in the defined contribution plan, they are permitted to withdraw monies while they are in phased retirement to supplement their reduced salaries. And many participants do indeed do that. When we initially negotiated and put this program into place, we thought that only faculty members in the ARP plan would be interested in it, because in our defined benefit plan, their ultimate pension payment is derived based upon their 3 consecutive years of highest earnings. So for most faculty members, that's their final 3 years of work. And we thought, why would a faculty member want to voluntarily reduce their earnings and what will be likely their highest 3 years? But we did find that there were several who did choose to do that, felt that they had already achieved a 3-year earning history that was sufficient for their needs, and they have chosen. But by far, I can tell you that the majority of participants are in our defined contribution ARP plan. It was also important to negotiate that they would retain eligibility for full-time health benefits, even though they were working part-time, because our part-time employee rates are extremely high. And so that would not be, that would be a detractor to participating in this program. So we did negotiate that they would retain that eligibility just the same way as they did as a full-time employee, but other benefits that are based on salary, like the retirement plan contributions that the state system makes or their life insurance, are prorated based upon their new salary that is based upon their workload.
There we go. That's the last slide, Brenda.
Okay, great. So yes, as you can see, this is a voluntary program. It has to be initiated by the faculty member. Management cannot tell a faculty member, we want you to go into phased retirement. That has to be their choice. But management has to review and approve it. What the faculty member must recommend, or request what they're proposing for that phased retirement time period. And they can propose a reduction of anywhere between 50% all the way up to 99% of a full-time workload. And in the final year, that they can go as low as 25%. And again, as noted, it could be anywhere from 1 to 3 years. So management, must review and make a decision on whether they're going to approve it, reject it, or approve it with conditions. Like, we'll approve your application, but you need to change your workload to X percentage in this semester. That could be a possible modification. I can tell you that the vast majority of them that I see, and I see them all, they all have to come through the system office. We manage the program out of the system office just because it's a bit complicated. We also work closely with the union because they also require documentation around their members who are participating. So, I do have to say that the vast majority of them are generally approved as the faculty member has requested them. We do have materials on our website, and I think I sent you the link and you have it right up there, that we have some FAQs, we have the negotiated side letter, we have the form to request phased retirement, we have the agreement, which is actually in the form of a retirement letter. Once a faculty member makes his or her way through the entire process and has the agreement executed, they are bound to retire on that date. They can accelerate it if they want to, and sometimes they do. Things in life come up, then they, say, okay, I was going to do it for 3 years. Now I only want to do it for 2. We ask that they provide us with at least 6 months notice, and they generally do. But they cannot extend it. Once they've executed all the documents, they are locked into retiring on the date that they have selected. And in only under an exception circumstance where the president or his or her designee has approved it, may they extend beyond what their agreed upon retirement date is. In terms of participation, and maybe this is helpful for you to know, and this is, this certainly was questions that we were asking when we were talking to peer institutions while we were developing our own program. At any given time, we have somewhere between 700 and 800 faculty members system-wide who are eligible for this program, remembering that, of course, they already have to have the years of service that they need for retiree health eligibility. So out of that 700 to 800, I can tell you, based upon the data from the inception of the program, and the 2019-20 academic year was our first cohort of faculty members participating in the program. And that was our highest year. We had 34 phased retirement participants in that year. And every other year, it has varied somewhere between a low of 12 and that high year of 34. So this is not a widely participated program. We generally have less than 5% of those eligible who actually choose to participate. But another important thing that you have to keep in mind, at least with respect to the state system, is that during many of these years since 2019-20, we've had other initiatives to encourage retirement. We had an enhanced sick leave payout program. It was a retirement incentive program. If a faculty member who was already eligible to retire chose to retire under the program, we would apply a multiplier to their sick leave payout that was already negotiated in their collective bargaining agreement. We did this several times during these past 6 years. And so that truly has interfered with this phased retirement program, because the same people that were eligible for phased retirement were likely also eligible for the retirement incentive program. And so they kind of looked at it and said, you know, what's best for me? Many of them who may have been participants in phased retirement decided that just outright retirement was better for them. And so it's been really hard to get a good run rate on this program, just because we've had so much disruption. You know, we've had people in phased retirement who, when we introduced the retirement incentive program, they were also eligible for that. So, you know, they cut short their phased retirement in order to take advantage of the retirement incentive program. So it's been really difficult to measure for us. You know, we do and we have, and we continue to try to estimate cost savings associated with this program. Again, that's really difficult because, you know, we're weighing the reduction in salary against, you know, did we need to hire a temp, an adjunct, to backfill some of that workload? Did we have to pay overload to another faculty member to backfill that workload? You know, did we replace the faculty member after their phased retirement was over? You know, did we replace them? If so, you know, what did we pay the replacement, you know, faculty member? There's a lot of noise and a lot going on at the state system during this time that has made it very difficult to measure. You know, there, in addition to this, you know, we generally don't allow for additional workload assignments during the academic year, except with the authorization of the president or the designee. We put that language in to make sure that we had some flexibility in this program. We never anticipated it would be used as much as it has been. And that, you know, that's really a management issue. You know, we from time to time have other faculty members who, for various reasons, you know, can't finish the semester, get sick, need to go out on leave, you know, or unexpectedly, you know, retire without sufficient notice. And then, you know, we're left with trying to backfill. And these people are really easy candidates when we have extra workload that needs to be assigned, again, because we've been reducing our workforce. And so there's less faculty, you know, and some of the other faculty members might already have overload, can't accept more overload. So they go to a phased retirement faculty member because, you know, they're our most senior people, you know, they're excellent in their fields and they're a little bit more available. So we've done more of that than we thought we would be doing. These individuals are also eligible for workload assignments outside of the academic year. So winter session, summer session, indeed, most of these phased retirement faculty members pick up additional workload during that time. And so trying to truly evaluate the cost savings has been a challenge for us. But the one thing that I can tell you about this program, and probably at least, you know, while it is hard to identify exact cost savings, one of the very valuable aspects for us is that commitment to retire, so that the university can plan ahead and know, okay, this faculty member will be retired on X date. Here's what we need to do with that faculty line. We don't need to replace it. You know, we may need to replace it. We can handle it through reallocation of existing workload or overload or hiring an adjunct. It's just given the universities a lot more flexibility and the ability to plan. You know, as our student enrollment has dropped, as I'm sure most of higher education has seen that happening, and we're not quite, we don't think, at the bottom yet. You know, it definitely calls upon a need to try to manage our faculty workforce numbers commensurate with our student enrollment. Okay, it's been like a real brain dump. What questions can I answer, or what additional information can I provide?
First, thank you, Brenda, for jumping on from the East Coast and providing us this information. We truly appreciate it. I'm going to go ahead and open it up to our task force members. If any of y'all have questions. Do I need to call on people like I did last time? Okay. Dr. Glenn.
Hi. So as far as the approval from the dean or president, That's approval for the percentage of reduction, I assume, right? Not approval for the request itself. If the request is sort of a given, is that accurate?
Yes. Yes. If they would request something, unusual, like I said, they're very rarely not approved as requested. But if it would be some type of an unusual workload request, a dean might say, no, I can't approve this as it's submitted, but how about this alternative? I think there was really, and I don't even know if it was ever submitted, but you have to keep in mind we're a little unique too, or maybe not unique, but we have faculty, we have employees who are in the faculty bargaining unit who are not in the classroom. So, for example, our athletic directors are members of the faculty union. There was an inquiry by an athletic director. We could not accommodate it. We couldn't accommodate a part-time athletic director. The job demands a full-time effort, and it's difficult to hire another part-time athletic director to backfill. So that's an example. And I don't even know the person, the athletic director never submitted it. I think they were just kind of testing the water. So I would say if it's one of those positions where it would be, and there's not many of them, or it would be virtually impossible to find somebody to backfill that workload, it could be outright not approved. But that's not what we've experienced.
Anybody have any other questions?
I have a question.
Okay.
So for the employees that are on the program, are they considered full-time or part-time?
Well, they're paid part-time, but for certain aspects of their employment, they're considered full-time. That a good example, and those exceptions are outlined in the side letter that is on our website. That's negotiated between the faculty union and management. But one of the biggest or most important aspects where they're considered full-time is for health benefits, because again, it's a very big difference between full-time employee premiums and part-time employee premiums. So for health benefit purposes, they are treated like full-time employees, even though they're working part-time and earning a part-time salary commensurate with their workload.
And is there some federal statute that guides that full-time to part-time classification?
No.
I guess for me, I would look at our healthcare benefits, right? So in order to be eligible, you're either full-time or you're retired, period. So for the folks in the room, they would have to make the determination of what's considered a full-time employee, but that would have to also be in compliance with the federal statutes, and that's per law. So I don't know how you guys determine what's a full-time employee, but in Louisiana, you either have to be full-time or you're retired. There's no in between as it relates to benefits. So I'm just putting it out there, just curious how you guys if there's any guidelines. I know ACA has some guidelines of.
Yes, and we comply with the ACA. So if an employee, any employee, this is beyond faculty, meets the ACA requirements for benefit eligibility, then we provide them with access to our ACA health plan. For our faculty, under the terms of our collective bargaining agreement, faculty members who work at a 50% workload or greater for at least one academic year, so that includes our temps, they are eligible for our health plan. So we've already established through negotiations eligibility for health benefits for part-time employees. What we've agreed to under the side letter for the phased retirement is to allow these phased retirement participants to continue to contribute at the full-time faculty member premium contributions versus a part-time premium contributions, which would be higher. So we do comply with federal law with regard to providing benefits for eligible employees under the ACA, but our health plan, our benefit structure as negotiated is more generous than that.
Any other questions? Yes.
I just have a question. Is there you may have mentioned this, I'm sorry. Is there a mentorship component to your phased retirement plan, or would faculty just do faculty workload reduced?
It's their workload is reduced across all three key components of a faculty member's responsibilities, which is teaching, service, and scholarship. And so it's an across the board reduction. In terms of mentorship, there's nothing formal put in place. One of the requirements of the phased retirement program is that if a faculty member who wants to participate is a department chair, it generally, unless there's an exception granted by the president, it generally requires them to relinquish their chair role. So in essence, kind of passing that on to another faculty member within the department.
And can I just get clarification? So when they go to like 50% effort, that 50% has to be applied equally to each of their job responsibilities, or can they pick and choose which 50%? Like if they say, I only want to do research, and so I'm going to get rid of the 50% of my appointment that's teaching and go to the 100% research? Or is it that if you go to 50%, it has to then be applied equally to service, research, and teaching? So there's always a teaching component for someone that had initially in their job description.
Yes, that's correct. It's 50% across the board. So they still are retaining their teaching responsibilities at a 50% level, 50% service, 50% level for scholarship.
Thank you.
It's hard to measure, especially scholarship. It's very difficult to measure, as you can imagine. But it is a drop in the faculty workload. And just for perspective, so our faculty members who are solely teaching undergrad courses have a 4-4 schedule. So 4 classes in the fall, 4 classes in the spring. That's a full-time faculty workload for a faculty member who's teaching undergrad.
Brenda, if y'all don't mind, I have a quick question as it relates to faculty, the definition of faculty. Does that include just the assistant, associate, and professor, so tenured positions, or do you also include instructors in that definition?
So this program, the phased retirement program, applies to regular faculty, so non-temporary. They have to be, and regular for us, as defined in the collective bargaining agreement, is tenured or tenure track. Now, realistically, everybody's going to be tenured, because if you were still on the tenure track, you wouldn't be eligible for retirement.
But not non-tenure faculty, non-instructors.
So the collective bargaining only includes those who are full professors who have tenure.
This program, yes, not full. It's faculty members, regular faculty members, which in our collective bargaining agreement is tenured or tenure track.
Okay.
Does not include what we call temps, what you might call adjuncts.
Mm-hmm.
And then, as I mentioned, we have a collection of other positions that are members of the faculty bargaining unit that are probably not the norm. Our athletic trainers, our athletic directors, our librarians, our counselors that work in our counseling centers. They are members of the faculty bargaining unit.
Anybody have any other questions? Eddie?
I've got a question about faculty who initiated to participate in the program, but the university didn't have a need, let's say, for in a particular department, let's say the College of Engineering, and was denied. Do you have an appeal process? And if the university ends up not approving it, or did you have any difficulties, challenges?
We've never had any of those arise. We've not had, there is no formal appeal process. This is not subject to grievance procedures. And so, it's fortunately something that we've not had to address. And like I said, the only situation that I'm aware of, and it was never even formally submitted, where an athletic director was thinking about this, and there was conversations as to how this would not be something that we could support.
Anybody have any other questions? Well, Brenda, thank you so much again for taking time out of what I know is a busy day, especially for all of us in the room who are just starting school. So we really appreciate the time and once again, thank you for speaking to us down here. So.
Thank you. Happy to help. And if you have any follow-up questions afterwards, feel free to reach out to me. You know where to find me. It was
Okay.
really nice to see everyone. Good luck with developing your program.
Thank you, Brenda. Appreciate it.
Bye.
Bye. All right. So next on task is Kristen Bach and Rachel German. They are representing Loyola University down in New Orleans. We have both the benefits manager and the director of human resources, and they provided some slides. So I will go ahead and switch it over to you, Rachel and Kristen. Thank y'all for joining us today.
Oh, you're welcome. Good morning. I think a lot of what you are going to hear from Kristen and I is very similar to what Brenda just shared. So it was actually really helpful for us to kind of also hear about another university. As it was said, I am the director of HR and payroll, and Kristen is the university benefits manager. Technically, our phased retirement program is actually managed through the office of the provost. We support the program from a benefits perspective, and a couple other little ancillary areas. So I'm hoping I will be able to answer all the questions that you have. If there are questions that are outside of my purview, I will certainly follow up with the respective folks, get the answer, and get it back to you all. But hopefully I'll be able to catch a lot. One thing is we are not a unionized environment. So that is one of the major differences in how we negotiate and manage the plan. We do not have that extra layer incorporated into our phased retirement. So the purpose of our plan is to provide an opportunity for eligible full-time tenured faculty members to make an orderly and smooth transition to retirement through teaching and other various types of service we'll talk about later on. We also do not provide this program to staff for really a lot of the same reasons that Brenda shared, the challenges of doing that with staff roles, with bandwidth, the financial impact of having to potentially have two concurrent salaries, even though they'll be proportionate. In some ways, they'll never be equal. So it's an increased cost to the university and more likely than not for a defined period of time. So this also is only for tenured faculty. We also do it, as I said, through a reduced teaching load or service over a defined period. Our tenured faculty members have to be 60 or older and have 15 or more years of continuous service with the university. That is not specific to our retirement age. At Loyola right now, you could be a retiree and eligible for retiree benefits at the age of 50 with 5 years of consecutive service. And our duration of our phased retirement program is also up to 3 years. More often than not, in HR, we see folks taking the full 3 years. Every once in a while, I'll see a 2-year plan, but generally, it's always the 3-year plan. In year 1 of our phased retirement, we maintain full-time status, and they're at 100% of their salary. In years 2 and 3, we also maintain their full-time status, and they drop to 50% of their base faculty salary. And that base faculty salary is always fixed through the duration of the program. It doesn't go up, it doesn't go down. Much like Brenda's, they also complete a work plan. So we do not suggest or drive someone relative to phased retirement. It is their decision and they bring it to the table. Now, I'm sure conversations are had if someone's been talking, and I think this is more often than not, that they're really ready to retire. They really have it close on their horizon. And this is a way to ease that retirement for both the employee and for the university over a 2 to 3 year period. So once those conversations are had, they develop a work plan. The faculty member, their department chair, and their dean negotiate a plan that's mutually acceptable for the faculty members' duties during the phased retirement program. I have not been aware of anything that's escalated beyond the chair, the dean, and the faculty member on a work plan that the faculty member wants that's not agreeable to the university. My sense is more often than not, they all are pretty amiable, understand what the parameters are, because we have had this since before I have been here, and I've been here 15 years. So I think it's kind of intuitive for folks on how they would approach it before they even say anything about it from a faculty standpoint. The activities that they can engage in is teaching, research, service, and various administrative assignments. And it not only aids us in having someone over a defined period of time, continue these work processes while we determine how we're going to manage forward. But it also does a lot for the faculty member because they do remain actively involved in the university, and sometimes it gives them more of an opportunity to really focus on those things that they have really enjoyed throughout their career versus not having the time to put all their effort towards it for a good bit of their time. For us, faculty members retain their professional rank and tenure throughout the program. The faculty member remains eligible for all full-time employee benefits, which also includes their health, their life insurance, and retirement. Though they drop down to 50%, the guidance we have been always given by our our benefit broker consultants is that if we have them not carved out, but specifically called out, and Kristen can speak to this too, in our summary plan description, that though they are going to be working for a period of time less than 30 hours, that they still remain their full-time benefit eligibility status, so that they are also not losing medical insurance and other insurances that they would no longer be eligible for, because it will not be a driver for someone to go into this program. If they know they're going to lose their insurance, they don't have other forms of insurance to assume, it is going to be very detrimental to the engagement in this this program. We do not have a pension. We're a 403B for our retirement plan, and they still actively engage in that. Kristen, is there anything I'm not thinking of? Okay. At the conclusion of the 3 years, their employment ends and their tenure with the university officially ends. If they're going to be provided emeritus status, that is going to be something that's managed outside of this process. We also have on our website, which I'm happy to send the link. Our website, though, is very open to the public. Anybody can go on it. So it does have our phased retirement policy. It also has a copy of the work plan that our faculty members complete. And it has a copy of our election form that the faculty will also complete, identifying their their percentages of engagement, et cetera, between training and research, not training, teaching, research, service, and administrative duties. So it really encapsulates a lot of it. I really feel like our phased retirement is pretty straightforward. It doesn't have, a lot of nuances to it that someone in a different environment, i.e., a unionized environment would have. It's well received here. We usually end up somewhere between 3 to 4 folks at any given time on phased retirement. Right now, we do feel like it's gotten a real kind of uptick in it. We have about 8 new phased retirement members starting this fall, and a couple, about maybe 3 or 4, that are still in the process of working through their phased retirement plans. So we have seen a little bit of an uptick. What else? For us as well, just really, as Brenda said, having this in place does really get a commitment to retire. Not that we really necessarily want anybody to retire, but I know it's a challenge being in HR when you have employees, whether it's faculty or staff, that are saying, I'm so ready to retire. I'm going to retire. And you're thinking, you've done this job for 30 years, we're going to be in a little bit of a hole if you retire without giving us much notice, but I can't push you to retire. I can't really push you to tell me when you're going to retire. So this does kind of take a lot of that ambiguity off of the table. We know this person's retiring. We know they're retiring on X date, barring any illness or extenuating circumstance that we would have to revisit the plan. And maybe it's no longer 3 years and it's 2 years. But barring those real one-offs, it gives us the opportunity to roadmap out to whatever extent that academic unit wants to, the plans to replace that role. And much like Brenda, often it's utilizing of overloads, it's utilizing of adjuncts, looking at a different way to provide certain information, or certain classes. So it gives them that opportunity to do that. I think some units give it a lot more forethought than others, but it also depends upon their needs. There is really not, I know the question came up about a mentorship. There is not a formal mentorship program for this. There could be some, for all the reasons that Brenda said and I just said, there could be something informal within a department to whatever extent, especially if it is a chair who is going to be going under phased retirement. And it is very nice to have that overlap versus coming in cold for a new chair, to have some overlap for support and assistance. But there's not a formal mentorship, and I am not aware of a formal appeals process either, because we just don't have that. When someone's ready to retire, we're thankful that they have chosen, they want to give us those up to 3 years under phased retirement. So we're not pushing back. So that's really kind of everything that I had.
Thanks, Rachel. Thank you, Kristen. I'm going to open it up again for any questions for Loyola. Ready?
Before, there was no real way to calculate cost savings. Have y'all had more success with that, or?
Not that I'm aware.
Cost lower?
No, I did want to connect with our CFO. He is very new though. He has only been here 6 months. So he has not been through a full cycle of this. I don't think, just in my time here and reporting quite often to the CFO, I don't think that there has been a lot of ability to really capture the cost savings, because each department does something different in how they replace the role. And there's so many scenarios to where I could see a cost savings, but you don't know until really the final moment, I think, sometimes on where they're going with it. I mean, if you have a tenured faculty member who's been here quite some time and you're looking at, let's say, benefit costs, where a self-funded benefit plan, and so you have those costs as you do with any employee. But then if you are replacing with all adjuncts that are not benefit eligible, so then you have a reduction in those types of costs. But I find there's such a spread on what each department chooses to do. And depending upon the curriculum and the expertise and specialty of what that faculty member was teaching, sometimes when you go out to market, you may be paying more in just baseline salary than you were for the incumbent. So that becomes problematic. But conversely, if you're just, you had I'm making this up arbitrarily, $110,000 faculty member, but you're going to spread their teaching load over 3 adjuncts at $3,000 a pop, you're going to see some savings there. But I don't think we have really sat down that I'm aware of, but I will follow up and check and done a really deep dive into the financial savings.
Anybody have any other questions or comments?
I'll ask a question about, you'd mentioned that y'all are a 403B retirement system. And you mentioned that they stay actively involved with that in this phased out period. So they're just, let's say you put up 8%. So they continue to put up 8% of their reduced salary into that. And then do you have instances where those faculty to supplement their retirement, that they're pulling money out of that?
So I'll let Kristen speak to that as our benefits manager.
Hi, everyone. So they do still receive if they are eligible for the employer contribution, which at this stage of their tenure they would be. They still receive the employer percentage contribution based on the pay they're receiving at the time in their phased retirement. The contribution that the employee makes is up to them, so they can change their contribution amount of how much they would like to put in the plan at that point in their tenure. As far as distributions, our plan does allow for distributions after reaching age 59 and a half. So someone could take a distribution. In my time here, I have not necessarily seen an uptick in distributions coinciding with phased retirement, though.
Any other questions or comments? Well, seeing none, thank you, Rachel and Kristen, for hopping on. We appreciate it. Even though it is a short drive from New Orleans, we understand that y'all are on home today.
With traffic, it's not always short.
The traffic, the students are all back, it's the whole thing. So, but truly, thank you both for joining us today. We really appreciate it.
We're happy to do so. Y'all, good luck.
All right, thank you.
All right, thanks. Bye-bye.
All right.
Those are the two.
Those are our two presentations today, yeah.
So I think let's continue on with the agenda because we have plans for some discussion on these items a little bit later. So let's move to the next item, which is fiscal impacts of phased retirement plan off.
So I looked into this as per Tommy Smith's request. And it came out to be like a pie situation. There's really no way to determine what we're looking at based on the feedback we received, because it could be, as Pennsylvania noted, it could be an impact of, 1% of your retirement eligible. It could be an impact of, 5%. So there wasn't really a clean way of determining what the fiscal impact would be, because it's also dependent upon, are these, are we including all of our professors? Are we also including staff? What are we looking? So fortunately, I could not provide a very clear number for y'all, but that certainly goes straight to the discussion that needs to be housed at each of your systems. And that's another element is, the needs of LCTCS are probably different from the needs of LSU, as are ULS and Southern. So in that regard, there wasn't a real clear determining factor of leading to how this will look. The discussions that we had, that we just heard, is there a cost savings, as Eddie, you asked, again, is very dependent on the situation at hand. Certainly if you've got someone who wants to retire and they're in the engineering school and you've got a salary that you've been paying $200,000, and now you're able to find someone to backfill it at an adjunct rate of anywhere between what they assume is $3,000 to $5,000. That's going to be some significant cost savings, but again, it's very dependent upon just so many variables. So I just wanted to also bring that up and open it up for discussion, in that regard as well. Yes, ma'am.
I have a question, I have a question about the health benefits. So if I understand Mr. Williams.
I'm gonna leave that.
If I understand you, your comment earlier, if somebody goes to 50% effort, are they able to keep their full-time benefits at the institution or? Yeah, I mean, I know generally for people, at least at LSU, I don't know if it's a state thing, but if they're 50%, they're not benefits eligible. So how do we deal with that? Or can we not deal with that?
I think it depends, right? And that's where my question was. So
Okay.
for OGB, the way we do it is we depend on the agencies to provide us with that information. But the way it's written in statute is that they have to be full-time according to the agency, and they have to follow, and that full-time is defined by federal law, right? So they have to meet all federal guidelines. So I guess the question would be on the federal side, from a payroll perspective, would that be considered full-time or part-time? So from an OGB standpoint, then this would be agency-wide too. There's a couple of things that would drive the way we would look at it. So like I said before, you're either retired or you're active. There's no in between. If you would consider somebody remaining full-time, the way it would typically work is that obviously you would pay your benefit however you would pay it, right? And then the question then would come from the participation standpoint on the schedule. Employees get a percentage of contribution based off years of service, right? And continuous years of service. So if you had an employee that had, let's say, 10 years, and they would receive a 15% contribution from LSU or whoever it would be into retirement, the question now would be, are you considering them full-time? And while they're working reduced hours, are they still accruing hours that would then go into that service credits that would impact the fiscal impact to the universities? Because you pay higher, depending on what that looked like. So I think it's a question, right? Or what do you consider full-time? Because the way it reads in statute is an active employee that is, it's a full-time employee that's defined by a participating employer and in accordance with federal and state law. So that's the question that needs to be determined what that is. Typically, I've always seen it as part-time, no, full-time, yes. But I think that's the question.
Clarify, Dr. Katz?
Yeah, well, I mean, it doesn't clarify, because I told him the same question he does, but I just want to make sure I understood that from what he said earlier, right?
But what it means though is it's our definition of full-time. So at LSU, our definition currently is 75%. But we could change that to say if you're in this phase program, if we're abided by federal statute, whatever that is, I'm not sure what that is, but we could say if you're in this phase program, then you're still considered full-time.
If it meets
I
federal.
mean, what you see is yes or no, right? Full-time or.
Yeah, I mean, it's up to the participating agency, right? As long as they're in compliance with federal statute, but it's also up to the agency in consideration whether or not they want to pay more, right? Because it really, for me, it shouldn't add anybody else onto my books per se. However, how much the university would contribute would go up. And then also, if you were to follow what would be the current procedure, which would be they become a retiree and then you rehire them, the university is going to pay less. Or actually, the university is going to pay more they're going to pay more when you rehire them versus the other way around. So it just depends on how you look at it. It becomes a fiscal question at that point.
But if they do go part-time, if they're considered part-time, they lose OGB coverage, they can't have it as retiree at the end of the phase retirement. Is that correct? You have to retire with the insurance.
So as full-time employee, how do we define full-time would be the question.
I guess the question is if they're defined as part-time, they would lose their insurance.
That's correct.
And they can't get it back at retirement because they didn't retire actively having the insurance.
They have to retire, correct? Now, they could continue working, right, as they would work forward. The question would be if they dip below that period, then they wouldn't be active, which means they would be forced to retire, right? So then that's the That's the delineation that I keep speaking to. For OGB, you're active or you're retired, period. So the question, how you get there would be what we would have to determine, and that the full-time piece here is the question, right? Is that considered full-time or part-time?
What I found interesting, and I included it in your packets, is the federal government has a phased retirement plan. So we were able to find a memo describing some of the different elements that you brought up, as well as some of the other questions and calculations, and how the United States Department of Interior does it. And you can see on page 7, they have a phased retirement formula that includes the basic annuity computation. And then also they talk through on page 8, on the back page, the benefits and note some of those federal statutes that you were stating as well. We tried, of course, to get someone from the feds to speak to us, but they weren't interested in joining our conversation. But we were also able to include the phased retirement agreement as well. So you can see it's a little bit more lengthy than what we found for or what we were provided by the state of Pennsylvania as well. So we just wanted to include that as you go back to your system leadership and think through how you may want to approach this, if at all, going forward. Does anybody have any other questions? Since we have our benefits leader here, if anyone wanted to ask any more questions related to the health benefits aspect as it relates to a potential phased retirement program. I know that was one of the key, one of the bullet points within the resolution that we had to take into consideration as well.
I think the other question that would also have to be answered in this room is that not all of these universities are going to be on OGB coverage, right? So LSU First would have to answer some of those questions. Additionally, while theoretically under statute, they do fall under OGB, they do make benefit decisions on their own. So their benefit decisions could contradict something within that's being discussed here also. So it would be a discussion with them if you were part of that system.
So it sounds like to me for Loyola that they simply defined what full-time status was.
Yep.
And most faculty members at this stage are going to be exempt. Fair Labor Standards Act. As I understand it, the Fair Labor Standards Act does not have a definition of full-time versus part-time. So my question is, can we do the same thing in terms of define what full status means? Full-time status.
I would say, based on what our colleague at the table just said, the answer is yes. And
I have an attorney
I don't think
digging.
you say comma.
I have an attorney digging to see if there's a definition for active anywhere in our rules or in statute. Because what I would tell you on a Loyola standpoint, and y'all correct me if I'm wrong, Loyola is going to be a private university, right?
Yes.
So they're not participating in the public, the retirement and the benefits package. So they can make those decisions arbitrarily as it defines them. For you guys are going to have, it's going to be a little bit more complicated because you're going to have to dig in all of these statutes to figure out how things are defined. It's not going to be quite as easy.
Correct. So, yes, he took my point. I was gonna say yes with a comma. As is the case with many of our institutions, we are approached a little differently than our fellow state agency colleagues. Just in general, LSU First is different. You know, LSU has a bit more autonomy in general than some of our other state agencies as well. And that's LSU, the flagship, not the other institutions within the system as well. So there are different considerations Yeah, as we talked last time with LCTCS, they lean much more heavily on that adjunct part-time instructor as opposed to the very traditional assistant, associate, full tenured track position. In our research and what we're looking at, more often than not, phased retirement is focused primarily on faculty. And I think it lends itself to that because of exactly what we were just talking about, the definitions. There's a little bit more of an ease to determining what those definitions are and what that looks like, as opposed to a standard staff, Monday through Friday, 9 to 5 type position. But again, that's why we were intrigued that the federal government had one. And that's certainly not to say other states don't have one either. Some states provide it, as I noted last meeting, some states will provide it for their state agencies, and they do not provide it within their higher education public institutions. So it's really a mixed bag, and that's part and parcel to some of our conversation. I certainly don't want to say, at the end of the day, to determine our recommendations is that this is not something that we see as being feasible or not feasible. But that can be a recommendation as well, that is, based on the information we've gathered, that this is not, something that we see moving forward at this time if XYZ changed based on what what our lawyers may come back and say. We can certainly provide that in the recommendations, but again, it's also very system specific as well.
I may have misinterpreted, but in the Pennsylvania State presentation, it talked about employees would have to meet the criteria for benefits before they'd be accepted into the program. Would that make a difference? Let's say if the minimum was 20 years, and so they qualified for full benefits, would that be something that we would consider too, so we don't have to worry about losing?
Might be mistaken, but I think her reference when she said benefits, I think she meant retirement benefits, not health benefit.
That's how I understood it as well, but we can clarify it.
Right.
Well, I mean,
Yeah.
it's something we would want to consider to make sure that we're unintended consequences.
Sure. And I think, for those of us who, want to go back and speak to some of your human resource directors, at the institution level as well and gather some additional information from those institutions. Because you've got 9 very distinct institutions within your system right now, and what right, what might, work for Nichols may be different for Grambling. And similar with LSU, they've, 2 health science centers, Pennington, LSUA, LSU, what may work for one may not work for another institution. And I think that goes straight to what Representative Bakala was wanting us to do, was to have this very thorough conversation and make sure that we gathered as much information before, setting forth any type of legislation moving forward into statute. So.
I think I'd like to go back to 5 for a second, if we do, on the fiscal impact. You very astutely moved that. I was impressed. I mean, that was really.
Thank you.
So I guess a couple questions. One is, I know the PA participation was relatively speaking, very small. What was the Loyola again?
It was also very small. She said anywhere between 3 to 8. I think they had their highest, which was 8 for this academic year.
So
on average 3 to 4.
Very small. So if we were to assume that if we did anything, that it would look something, in that range, then is it also fair to assume that what we heard was, while there's not been a significant, they've not done financial analysis necessarily on cost benefit. I almost took the conversations that it's positive. It's not been a significantly costly exercise for them because of some of the reasons that they describe. I guess what I'm saying is I feel like we might have heard from the finance side of it of, oh my gosh, from a finance perspective, if you have the opportunity to avoid doing this, by all means, avoid doing it because it perhaps such a small population. And that may not be a fair assumption, but I mean, I kind of took it that way, that it's a potential benefit that is such small, a relatively small group is taking upon themselves that it may not have that much of a fiscal impact.
It goes for all, if you look, and that was for the entire system.
Right,
Correct.
exactly. So,
Correct. And again, it is a system of what was 14, now 10 institutions, but they are, similar in structure to many of ours.
If there were a slight increase in cost, the benefits may outweigh that.
Yeah. Right.
Yeah.
Well, they both mentioned the true value is the planning, and we know that that is the most difficult.
exactly.
Replacing somebody with that kind of knowledge is very difficult.
That it would be and it would be difficult to quantify, put a dollar amount
Right.
perhaps to that.
Problem would be small, considering the number of participants.
That was just an observation, since we don't have any numbers yet. Then the other, like I said, yeah, right. Then, oh,
Can I interject something before you move on to the next? It seemed that the two folks that universities that we talked to, or talked to us, it was almost automatic. If you applied, you were approved. But I know that's not necessarily the case. Some other universities do it where it's more of a financial decision, maybe at a departmental or level or within a college. So I think how much it might cost would depend upon how it's managed.
Yeah, I found it very interesting when looking at both of them, that one requires the university president to sign off. The other just simply requires the department chair. That's a very different conversation that you're gonna have when you're looking at who's leaving and planning and just a very detailed conversation there. And then also with Pennsylvania, it's housed at the system. So they're the ones who manage it as well, as opposed to each of their 10 institutions within their system. So that is certainly something to consider as well. Rather it being a UL Lafayette decision, it would be a University of Louisiana system decision, and how to approach it in that way would also, present different or potentially unintended consequences that we aren't, thinking of or considering as well.
Have a early retirement incentive program where faculty member could apply for that program. And it's not automatic, based on certain criteria. One of them is the need. It could be financial, or it could be the college where they teach, whether they can fulfill their obligations without that person. So there were some criteria, some decisions made before it was actually accepted. I think there's an appeal process, but that's a strong driver in what we do for that program.
I think that also has to go to when we're thinking about our recommendations, approaching it from a similar point of view as well. Perhaps if we're looking at an English professor that maybe, and certainly haven't been hiring at a university level in about 15 years, but perhaps it might be easier to get an English professor as opposed to that electrical engineer whose focus is this, and we're required to have that as a course. I don't know, but that would certainly be part and parcel to the conversation and would go to the approval process as well.
For that program, the participation is much greater than what they use.
Mhm.
And it would require an outlay of cash. That was the incentive to get paid a lump sum to retire. And it was irrevocable once they did it. Like this, they couldn't turn back.
Well, the other issue that Pennsylvania brought up is that they, as a state, have had different incentives leading toward retirement as well. So that certainly led, to not as great of a participation in their phased retirement program.
Just one other question that I had, was I was certainly hearing the theme of it, the reasons why it would not apply to staff, which made sense. But speaking of statute, it makes me wonder, would there be any issue of providing something like this only to one segment of the population versus the other? Just
See it as an issue. Faculty always have different rules and staff.
just thought I would ask.
That was one of the reasons why I brought to the table the federal government phased retirement program, because they don't have professors in the same,
Right.
formal definition as we do around this table. And so how are they approaching it? From a state employee, or federal government employee perspective, as opposed to the traditional.
So it appears that it can be done.
Are you defining all of your employees as full-time and part-time in the same way? Because that could get you in a lot of trouble from a perspective, from a benefit perspective.
Right.
Because then you're messing with statute of what's considered what, and then you will be, that's where you would have an issue. Right, if you're saying for the faculty, you're considered full-time if you are X, Y, and Z. But from a normal administrator, you're a bookkeeper, whatever you are, you're an accountant, then we're gonna consider you for eligibility in the health plan of X or Y. Just throwing it out there, because I think you would get into an issue there, because then you're defining something that's defined in statute differently between two populations.
That's why I raised the question.
Yeah.
Yeah.
Anybody wanna talk
I
to
know
that
for-
now?
TRS
Thanks, Ray.
They are defined differently, because if you're the bookkeeper, it's 20 or more than 20 hours, you're full-time for our purposes. If you're 20 or less, you're not, but that definition doesn't apply to faculty. Just because you can't measure out their hours and say, did you work 20 or more? And so at least for membership in TRSL, they are defined differently.
Yeah. And that also goes to, I think, Dan, that this was your question as it relates to the 50% allocation between research, scholarship, and teaching. How is that applied as well? That goes straight to the difference in defining our faculty and staff as well, and that contributes to what you just spoke toward. So our faculty aren't necessarily, they're not in a classroom 9 to 5. They're gonna be in a classroom, as we all know, that 9 to 5 may be a 9 PM to 5 AM type situation, depending upon, what the course is, or they're gonna be, working out in the field in Slovakia doing who knows what. But those are how we define, how we have to put forth what that definition is. So it's very much not the typical state employee 9 to 5 definition. So. Anybody have any other
Unless
questions?
anyone has anything else, I'm good, Elizabeth, for you to go to 8. What is that, 7?
I
If I can read my
jump
Roman
in that
numerals.
now.
You can do that.
Okay. Great. Okay, so during the last meeting, some of y'all asked for some additional information, so I wanted to provide it here. Based on the ORP contribution rate, this was information that we gathered as a projected calculation from last year, moving from that 6.2 to that 8%. There would be an increase of a little over 11 million, and can talk a little bit more to this as well. But I think our mathed up. If we checked, we were both pretty spot on. And this is reported by each of your systems. So that would be the potential increase to each of your respective systems should we move from that 6.2 to 8%. Again, as we provided, as y'all saw in the task force recommendations last year, you saw in there that 6.2, us being at 6.2, we are on the lower end in comparison to our fellow SEC colleagues. So that is certainly part and parcel for the conversation. Of course, that 11 million may be something, there's the flip side of it, which is there's not a guarantee that will be, that increase will be appropriated to us during the next legislative session. As we are all very much aware of that as well. But I did want to provide that calculation for you. I can't remember who asked, but I wanted to make sure that information was provided here.
Elizabeth,
Yes.
these numbers are before people move from ORP to TRSL?
Yes.
Wouldn't that impact some of the numbers?
It would have some impact. Yes, this information we gathered right before session, so March was this information. But I'm not sure if there was a large movement from ORP to TRSL.
I think it was under 1,000.
That's what I thought it was. Yeah. So
I was just curious.
it could have some, but
Yeah.
not as great. But I like the way you're thinking, Gina. So, does anybody have any questions, comments as it relates to this potential increase for each of our systems? I didn't think so. I didn't think there'd be much conversation on this one.
Let's go back to that. You said, and I just want to make sure I'm clear.
Mhm.
You said that we probably won't get the funding, which in my history here, we haven't, but they take away the savings, whatever their savings of the payment.
There's
But
no guarantee.
I know, I understand that, but the payment that we did when we went from, right, we were at whatever TRSL told us the regular rate was, and we went back and said, let's get it up to 6.2. So the institutions are already paying over the TRSL rate to get there. And if I recall, we got $0 from the state to pay for that. I don't know if you were here then or not.
Might have been in Pennsylvania.
Okay. But I recall there was no funding given to the institution to do that. So following that history, I would not expect us to get any funding going forward.
I think it is appropriate to be mindful that our our legislative leadership and governor is very mindful of being fiscally responsible and fiscally aware of our taxpayers and what that means, and that reflecting on being mindful of our citizens of Louisiana, that they maintained, Governor Landry was a strong proponent of maintaining a standstill budget, and we have, we are respectful and mindful of the decisions that our legislative leaders make on our behalf. So,
Yes.
but this may be something that your systems or institutions, think it's important to move forward with, and could, if that's a recommendation of the task force, then we can put that forward. Again, Representative Bakla was very supportive of this. He certainly, was very mindful of that low number, but he was also very mindful of it being cost prohibitive to the state and being, very much aware of being fiscally responsible. All right, so moving on, unless anybody has any other questions or comments. Okay, so I wanted to just bring this up so that there could be a comparison, and Trey, you can certainly correct me if I wrote anything incorrect as it relates to TRSL and our lasers. But this goes to some of the accrued leave enhancement conversation. So I just wanted to do a quick comparison between annual and sick leave, as well for how it's handled by TRSL as in comparison to how it's handled by lasers, as that was also part and parcel to our requirements for the resolution. And so you can see here that at TRSL, our annual leave, the state employees are normally paid for about 300 hours or 37 and a half days of annual leave. It's not used to attain eligibility for any benefit, nor in the computation of average compensation, which I'm sure we're very much aware of. Sick leave, similarly, we're allowed to convert up to a year of unused sick leave earned for those on or after July 1st, 1990. There are rules previous to that, but with many, most of our team is after that 1990 date. Trey, do you want to comment before I move to lasers, or?
Just say that your sick leave balance might be different with us than it is with your employer.
Yeah, there is, I believe there's a form,
Formula.
yep, that we have to provide, and I know there's a checkpoint system that is in place.
We're missing ORP members here.
I know. It's a little different because there's not. That's buying into ORP, there's not a sick or annual leave.
Yeah, they just get,
component.
they'll
You
get
just get-
300 of annual and they'll get 200 of sick on their way out, but nothing converts to anything. So it's one less benefit to them as well.
Correct.
That's only ORP, you don't get 200 of sick for TRSL, regular members.
Okay, say that again, Tommy.
So she was saying that you get 300 of annual, 200 of sick pay as term pay.
The TRSL people do too.
Okay, yeah.
So how do you arrive at the 300 hours?
Am I answer?
What about the 300?
Yeah.
Is that state law?
I'm pretty
I
sure
think
it's
it's a
state
state
law.
law.
Yeah,
Yeah,
that's what I
there's a
understand.
statute that talks about how to pay it out once it's employment. Yes.
Yeah.
I don't know the exact number.
Yeah, we can find that for you.
Have it somewhere.
And yeah, get it. I was trying to keep the slides to the point. Lasers, as you can see here, the unused leave is converted to days by adding the hours of annual and sick leave and dividing it by 8, which of course represents the 8-hour day. You can convert it to credit, or you convert it to a lump sum payment of the actuarial value. And so 2 different approaches. This is also part and parcel to the conversations that we're to have as it relates to the resolution. So I just wanted to open it up to Trey if you had any comments or anything else related to the TRSL
So
process.
the sick leave portion of the resolution mentioned participants, and that's what we call people in the ORP. So it seemed to be asking us to look at whether we should allow some type of leave payout to allow them to contribute on a leave payout and add that money to their ORP, which would mean you could count it for ORP earnings and the employee would contribute their 8%. But then if you did that, the systems would have to contribute their 6.2, or it moves to 8, they're 8. So that's probably something that by law could be done. It's just whether that's something that systems are open.
Or even just a larger payout for ORP members since there's no conversion allowed.
So Gina, you're saying instead of 300, it would, or 200 rather, it would be 300.
Something like that, something that equates to the 1 year that the TRSL members get.
That would certainly be something to consider and discuss, and I'm sure TRSL would provide any additional information as needed to move that forward, if that's the way of the recommendations. Great. Moving on to the next aspect of our agenda. Oh, you had questions?
Well, I just was gonna ask on the unfunded accrued line, because we were talking about funding options.
That's in other business.
Yeah, in my mind, it was the funding, so you got to take care of.
Not a problem. So once again, I just wanted to make note of our future meeting dates. September 17th is our next one. We're gonna be diving into, if you could, please come with some recommendations as it relates to the phased retirement options. Bring that feedback so we can start moving forward and putting those thoughts to paper and going from there. We have also invited presentations by NASRA and our ORP providers. And should you want any other presentations, please let me know and I'm happy to reach out as well. I can do some fiscal scenarios, but as y'all are aware, some of my information is limited. Gina, do you have a question? Is that your hand up for a question? Or- oh, okay. Okay. All right, just double checking. So in other business, I wrote up the UAL. So as you can see here, this is in higher education, we pay our UAL through state general fund as reported within the executive budget. So I included both 25 and 26 as it's reported again on the Division of Administration's website. You can see here how our UAL payment is for 25 and the projected payment for 26 as it stands right now. Again, this is information I pulled off yesterday. Don't anticipate anything changing, but anything can always change. So you can see that there's been a slight savings between previous year and current year of about 5.5 or so. And then you can see the distribution as it relates to our UAL payments and by system. Is that the information you were requesting?
I think that's a good start.
Oh, thank you.
Yes, thank you. Very good.
Is there additional information you would like as it relates to UAL?
We'll digest that.
Okay.
And then go for it.
Yes, I can also get it based on each institution.
Well, because I think we were talking about it as a potential funding source for on the other expense, but I'm not seeing.
Well, I did not provide that information because that has not
It's
been,
gonna pass.
yeah, it hasn't
exactly.
been voted on yet. So that is,
Passes, that's when this.
About the 81.
yeah,
million.
81 million. Yeah, it's similar to what they proposed in for a previous fiscal year, similar amount of about 80 to 85 million, I think is what it was.
It's all gonna depend on how much money we actually get, but the
Yep.
projection was about 81.
So I can,
Maybe,
I have that already done. If you'd like me to pull that up.
because if we could put that in there in the next meeting, we just have,
Send that out to y'all.
even though it's an unknown, we would, here is a potential
Sure.
example of a funding source if it would be done that way. And this might be a topic that could be put forward as in support of how it could be used, or a
Sure.
request of how it could be.
Yes, and that was part and parcel to our recommendations last year as well by the task force is that that 80 million in savings, we did request that it be used and remain within higher education. The difference is that those dollars do revert to the general fund. So it is at the discretion of our legislators and how they'd like to reappropriate those dollars in the end. So,
Thank you.
but I am happy to give you that as well. All right, any other questions or comments?
Shall we move to adjourn? We would need a motion to.
So moved.
Second. Wait. Do we have a second? I heard a bunch of seconds. You can choose whatever you want. All right, thank you again. We did, let it be noted that we did it in early again.
Yeah.
Wow, so well done. Elizabeth, thank you very much. Safe travels, but